Why your teeth aren't white and the science that can fix it. Welcome to Beyond the Smile. I'm Dr. Mahib Jaouni, founder of Endodontic Specialists and BioRejuvenate Med Spa, a board-certified endodontist practicing in Dallas for over 14 years. Over that time, I've performed more than 10,000 root canal treatments. My mission in this podcast is simple: to break down oral health topics with clarity and real clinical insight so you can understand your health beyond the smile. Most people think their teeth are yellow because they drink coffee, but that's not really the reason why their teeth are yellow. Let's dig deeper into that. Today I'm going to show you the real biological reason and how whitening works at the molecular level. Most importantly, how to whiten your teeth without destroying them or damaging them. Today we're diving deep into the neuroscience, chemistry, and the safety of teeth whitening. And I promise you, at the end of this episode, you'll be able to make smarter decisions than most people, and even most influencers online. Why teeth change color? Let's start with something most people don't know. Your teeth aren't naturally bright and white. Your enamel, the outer shell, is translucent. Under its layer, there is another layer that's called dentin, which is naturally yellow. So you've got a translucent layer and you've got a dentin yellow layer. As you age, enamel gets thinner, dentin gets thicker. And because of that, your tooth color changes over time as you age. The enamel becomes more translucent and the dentin shows through it. Now, not only does the enamel become transparent and the dentin becomes thicker, but light passes differently through those layers. So your teeth will look lighter or darker even if you perfectly clean them. Now add to that coffee, tea, wine, soda, turmeric, smoking, acidic diets. All those will lead to staining of the surface. They will stain your teeth. They will open microscopic pores as well in the enamel, letting pigments seep in. So whitening is not about scrubbing stains. It's about changing how light interacts with your tooth at the molecular level. How whitening actually works. Here's the real science. Whitening agents like hydrogen peroxide or carbamide peroxide, they release oxygen-free radicals. And those oxygen radicals, they penetrate the enamel, get rid of stains. They break down the stain and make them transparent or translucent, colorless compounds. This is called oxidation. And it's not a cosmetic paint. It's actually a chemical reaction that takes place on and inside the tooth. And whitening is done incorrectly, it can actually damage the enamel, the dentin, the pulp, and it can lead to sensitivity, sharp pain, gum recession. It can even cause the tooth to require root canal treatment. So it's definitely important that tooth whitening is done correctly. Professional versus over-the-counter whitening. So let's break down the real options. In-office professional whitening has a high concentration of peroxide. It's doctor-controlled, and they control the isolation of the teeth. They usually require short exposure, and it gives immediate results. It has the lowest nerve risk when done correctly. Custom take-home trays that are made by the dentist. They have lower concentrations. You can use them at home. It can be personalized to fit correctly and in trays, and then it causes gradual whitening. It has a best balance of safety and longevity. Over-the-counter strips and gels, those are mostly a generic fit. So if you're using a tray, it may fit properly, it may not. Has uneven contact, and it has a higher risk of burning the gums. Results are unpredictable. So you got to be careful with those. They're not bad, but they take longer to work. And like we said, the results are a little unpredictable. So let's talk about one more thing. TikTok hacks. These really damage the teeth. You got to be careful with those. Lemon and baking soda. I don't recommend that. Charcoal powder, hydrogen peroxide rinses, or abrasive whitening pastes that are used every day. These strip enamel. They don't really whiten the teeth, and they permanently weaken your tooth. So don't go for any hacks, please. Just stick to talking to your dentist if you really want to have a whitening kit, or if you want to whiten your teeth, or you can go over the counter, but don't go to TikTok. Once enamel is gone, it never grows back. So why does whitening cause sensitivity? This is one of the most misunderstood topics. Inside every tooth, there is tiny tubules. They're called dentinal tubules, and those dentinal tubules allow for fluids to pass through. And when whitening happens, it increases the permeability of those dentinal tubules, allowing for more liquid or fluid to pass through from one side closer to the nerve. That stimulates the nerve, causes pain. And that's why cold air or cold drinks or even breathing can hurt after whitening. But here's the neuroscience principle. Whitening more frequently at higher doses and more often can cause more nerve signaling, more pain, and more damage, long-term damage. This is also why spacing treatments properly and strengthening the enamel with fluoride, potassium nitrate, or amorphous calcium phosphate or hydroxyapatite is critical. Don't just do consecutive treatments. And then there are some additions that we can do, like making sure that we're using fluoride. There are some toothpastes that have potassium nitrate. Those are made to reduce sensitivity. There is amorphous calcium phosphate or hydroxyapatite, and those are ingredients that you can find that could reduce sensitivity as well. So find the right material to use and find the right protocols. Make sure you are following them to reduce sensitivity. The safest way to whiten your teeth, if you want to really have great results and you want to do it safely, then this is the gold standard protocol. Let's get our dental exam first done. Let's make sure we don't have any cavities or cracks or any other issues, recession. Those are all issues that could cause your tooth to become more sensitive after whitening. Whitening on unhealthy teeth is uncomfortable, and it's risky, and it's painful. Now, you can also use desensitizing pre-treatment. So we talked about some of those compounds earlier, and potassium nitrate or nanohydroxyapatite. Those are ingredients that you can use to reduce the sensitivity of the teeth before you do whitening. So that's another precaution you can take to reduce your sensitivity preemptively when you plan on doing your whitening. Now, you want to always get controlled whitening, either by using custom trays or professional in-office trays. You don't want to do it daily. You want to avoid overuse. That can also damage your enamel and cause pain and discomfort. And then you want to do mineral re-strengthening. So you can use remineralization gels. Those are available. You can make sure you're brushing with fluoride or calcium phosphate therapy. And then prevention. Prevention is the best way to avoid even needing whitening, or if you do need whitening, then prevention will allow that whitening to last longer. How do you do the prevention? It's by drinking through straws or avoid dark drinks, water rinses after the coffee, avoid brushing immediately after acidic food. You eat something acidic, it opens up the pores. Let's give it some time before we brush after it. Who should not whiten their teeth? So you should not whiten your teeth if you have receding gums. If, let's say you have an active cavity, you definitely don't want to whiten your teeth. You're going to have a sensitive tooth. If you have cracks, if you have large fillings, or a history of sensitivity, severe sensitivity. Whitening does not change the color of crowns, veneers, or fillings. You want to keep that in mind because once you do your whitening, your tooth is going to have a different color than your filling. And if that's not something you want to achieve, then you want to be cognitive of that. Fillings will not change the color, but your tooth will. So here's the truth in one sentence. Teeth whitening is safe, effective, transformative, only when the biology of your tooth is respected. Bright smiles are beautiful, but strong, healthy teeth are priceless. So if you like this video, you can watch that as well. And if you like more science-based breakdowns on dental health, aesthetics, and longevity, like and subscribe to Beyond the Smile with Dr. Mahib Jaouni. Keep your smile, and I'll see you next time in the next episode.